Okay, now it's okay. Yeah. So before I jump to the substance itself, let me talk about the framework. So these are the topics and the formats that we have chosen a little bit earlier this year that we are going to cover this year. As you can see here, there are 4 topics or columns like human capital management that we've covered the last time, sustainable health that we're going to cover today to start covering, because that's going to be only the first meeting out of, let's say, 8 or 10 that we'll have this year dedicated to this topic every month. It would be a recurring, like kind of a work group. Then the third topic is sustainable finance and banking, and the fourth is sustainable energy. And the angles, the aspects from which we're going to cover those topics are the 3 aspects that are mentioned here. The first one is the philosophical aspect. For instance, in the intersection with health, it could be like, why be healthy? Why a person can wish to be healthy? Why is it important? Why is it of any essence at all? Because as you know, a lot of people, probably most of them, basically either don't want to live long because they don't see any purpose in life, or don't want to be healthy because they don't see any value in being healthy, or they don't even understand what is it actually being healthy. What's the difference between the healthy state and unhealthy state? The second aspect is the handbook. So it's a practical guide for those who have already understood why be healthy, why to choose being healthy. It would be a practical guide how to be healthy. So the first question is why, the second one is how, and the third question is where is it going to lead us? So what is going to what the future is going to look like, in how people would be able to be healthy in the future, where we would definitely cover life extension, healthy longevity, probably even different sorts of immortality and things of that sort. Of course, using existing or appearing technologies and scientific discoveries. And I'm sure at least Amina can talk a lot about this. Okay, so that was the framework of the white papers or reports we are going to release this year. This slide kind of justifies why these very 4 topics we've decided to cover first and foremost. Well, as you can see, again, I will focus here on healthcare. Healthcare is in the left column of the needs of a human being. Like there are like top 10 of them. All of them are physical. And the right column is psychological or intellectual. And basically, healthcare covers at least all of the needs in the left column, because all of them, like air, food, water, etc., they are not needed per se. They are needed only and exclusively in order to be healthy. Okay? So those are just some factors, and we're going to touch upon them a little bit today, that are influencing healthcare. And even if we consider the mental health or intellectual health or social health, that is also a part of health, by the way, because as you probably know, the World Health Organization defines health as not only the absence of illnesses or some physical disabilities, but also as the state of complete social, mental, intellectual, and probably even financial well-being. So even WHO defines the word health in a very broad sense. And if we consider this very definition, then we can say that healthcare is basically about almost everything that is depicted on this slide. So basically, it can cover all of the needs, or at least it would intersect with all of the other needs. Then the right column, and here it is depicted in a little bit more detail, are the principles of the SDG Plus framework. Like, how do we look at the healthcare, for instance, in our case, and what principles do we apply in order to be reasonable, I would say, kind of an overarching word that describes all of those principles. So the first principle is scientificness, so that we base all of our arguments and judgments only on the basis of some scientific studies, and the more valid they are, the more representative those researches are, the better. Accessibility, that means that we basically aspire to make health as accessible as possible to all of the people on the world, on the globe. The third one is that we want not just to make it accessible, but also provide it with a high quality, with high standards, high technologies, services, and basically that they are efficient, that they reach the ultimate target of a person to be healthy. The fourth principle is measurability. So we say basically, if we can measure something like a biomarker, for instance, in our case, then we can manage that biomarker. Basically, by influencing that biomarker, we can say that we are becoming more or less healthy. And the ultimate biomarker being longevity, like how long do we live? And if we, and all those biomarkers either increase the healthy longevity or decrease. So basically they are the second level markers. The fifth one is consistency. It's very important to try to improve all the biomarkers at the same time, because it's usually very easy to influence this or that biomarker by depriving or diminishing or decreasing some other biomarker, right? But it's wrong, because it's still unhealthy. And the hard task of being healthy is how you can keep all the biomarkers within the reference parameters at the same time, or improve all of them at the same time. This is the very hard task. The sixth one is the continuity. That means that we not always only care about the healthcare of a person or of ourselves at the moment, like I want to be healthy this day, this week, this month, but we have to think about how we can be or stay or sustain our healthcare indefinitely. And not, again, not only our individual healthcare, but the societal healthcare, like the healthcare of each and every individual on Earth. Again, this is the hard task, the complex task, but this is why we're here, because this is the very demanding task to be solved. The seventh principle, it's also very important, is that we don't just do some charity, either in terms of content, sharing, or some services, or the money, or vaccines, you know, humanitarian help, etc., whatever, so that people, again, can be healthy in the moment or in some certain period of time. We say that we should create a system that would empower people to sustain their health themselves, so that they have the healthcare system, doctors, education, medicines, infrastructure, technologies, money, governance, etc., so that those societies could stay healthy indefinitely. The eighth principle is up-to-dateness. Basically, it refers to the first principle when we say that we don't only decide, for instance, on those biomarkers at the moment, but we have to update our knowledge base, well, as frequently as possible, like, for instance, every day, so that we are really sure that this or that biomarker, by influencing this or that biomarker, we're really doing the good thing. Because sometimes, as you know, well, always basically, science is not exhaustive. It doesn't have answers to all of the questions, and it can change its opinion in time, most of the time because of the new data. And so we need to update our knowledge base, our attitude towards our health, our principles and paradigm and approach and framework as frequent as possible. The ninth principle is very important, especially in regard considering healthcare, because we can say that sometimes we try to influence this or that biomarker just because it is there, and we know it has some correlation with our health, subjective and objective. But science can dive deeper, and for instance, you can basically tweak your genome in order not to have that biomarker problem in the first place. Right? So you tweak the operation system, the fundamental, the platform, rather than just changing the software. And the loss principle is, again, it's an overarching principle, not only for healthcare or energy or finance or human capital management, it's for all of the topics. Is reasonableness, is basically understanding that the main purpose of us being healthy is not hedonism, is not just a pleasure of feeling ourselves healthy, and even not the productivity, but that's closer to truth. But the only thing the only aim, the target, the reason for being healthy and productive as a consequence is to foster innovation, is to foster human progress, civilization progress, to understanding its purpose in the universe and to accomplishing this purpose. Again, that's all about the principles. And I guess I would try to start with the biomarkers. Let me skip probably a couple of slides. And yeah, I guess these are the biomarkers. So this is basically an attempt to answer the question. And I'm sorry, on this slide, there are no reference parameters, so quantified metrics. They should be there. Probably we can together add those. For instance, Alexei Moskalev or Dmitry Veremenko or Ruslan Shaliyev representing his company, Lithium. They all could help us to improve this list and to add here the reference parameters, again, for different ages, as you can see here. So those are the very biomarkers, quantifiable biomarkers. And again, within the reference parameters, that can help us answer the question, what is healthy? Okay, because waiting till the person is either dead or lives longer is a very long experiment, so we probably shouldn't wait till the last moment. We should somehow answer at each and every point in time that this or that person is healthy. And there are different approaches to that. I guess biomarkers is only one of those. Probably functional analysis, like either our organs perform their duties or not, or they're failing, is another kind of approach to do this. Probably they should be combined together. But this is a very preventative way of defining whether the person is ill or not, healthy or not, because functional diagnostics is usually done more rarely, and it's usually more expensive and hard and resource consuming to do. So as you can see here are the main biomarkers, and you can argue with that, you can criticize that, again, try to redefine those biomarkers, probably add some or delete some, or say that they have intercorrelation, or probably yeah. So basically, that's all the options that I can think of. As you can see here, the number of parameters grows with age. So this is, I guess, the last period of age where we have different biomarkers. And also, here is some sort of functional diagnostics, but that's basically the recommendations already. So that's not biomarkers answering the question. That's the recommendation what to do not to receive cancer. And what I wanted to show you here is another set of markers, but they are not biomarkers. They are rather eco-markers that, again, are scientifically proven either to cause health-related issues or not. I mean, if they are, again, within the reference parameters, then it's like a prerequisite for biomarkers to be within their reference parameters. Again, these are exogenic parameters, so not within our body, but about the environment. Okay, so and this is the second slide describing different parameters. Again, I will just list them: electromagnetic radiation, noise and vibration, just radiation, illumination, water, air, microclimate. And as you can remember on this slide that was in the very beginning, basically it covers almost all of the parameters in the left-hand part or column of this slide. Again, this is one of the main questions that we want to answer, like what is health, what is healthy and what is not. I will probably stop here for a little discussion or questions or comments or ideas so that it will be a little bit more a kind of a conversation and dialogue rather than monologue, and you won't be so tired and you see the change in the faces. And so, I will stop sharing for a moment. And please feel free to comment, share your ideas, expressions, like feelings, emotions, what you think about what you've heard right now. Do you agree or disagree? Please show your reaction in any way you want. Okay, Ilya, I see one reaction from you, thumbs up. Any other reactions? Please respond. Like, show us that you are still here with us. Kim, Mai, I see. Amina? Maxim, thank you.
I agree also. So we should add classification status like new biomarkers.
Okay, Amina, that's a nice idea. You will present it to the list. You mean the calcification of the arteries, right? The blood vessels.
Right. Yeah. Yes.
Okay.
But
okay.
Like scanning, but it's the same. Maybe it's another goal.
Yeah. So probably calcification has an intercorrelation with cholesterol, inflammation, blood pressure, complex intima media, and things of that sort. So do you think it has intercorrelation with those parameters that I've mentioned, or it's a separate predictor that is independent of those mentioned?
We have correlation with inflammation, of course, with C-reactive and different biomarkers. That we have some correlation, but is in other parameters. We should divide it.
Yeah, definitely. If it can enlighten like kind of our overall understanding whether we are healthy or not at the moment, it's like if it's a predictive predictively valid.
Yeah, predictive biomarkers for cardio attack.
Yeah, heart related diseases, cardiovascular diseases, I would say.
Yeah, cardiovascular diseases
and heart attack being like an epitome, like the main killer the main cardiovascular disease, ultimate, I would
Yes.
say.
Ultimately.
Okay, so Mai, you have a comment. Mental health. We can basically, you can help us to make an end through making a report, a presentation on mental health. Like, what is mental health? How we define mental health? How we define whether the person is mentally healthy or not? Whether it's just a subjective mark on the scale of 0 to 10, like I feel myself healthy, or what is that? What is mental health? So I guess this is the main question. And I think it is a little bit harder to define what is mental health. And there is less research on that for that reason. And it's harder to measure it. And it's harder to manage it for that person. But you're absolutely right. Mental health is one of the very important parts of the healthcare. And if you help us, because we're expecting that we're here gathering experts, not just enthusiasts who are eager to listen and learn, but also people who are eager to research and share knowledge. So if you want to make a report, or at least to invite some speaker who you think is an expert, like the best in the world probably, who can speak to that, then definitely we would appreciate that. But probably for now, it is not that much covered. But yeah, so we can now proceed probably to Yulia's part of presentation, and probably, I'm not sure because I don't remember exactly, probably she would cover this piece a little bit as well. So please, Yulia, it's your turn.
Yeah, thank you so much. Just answering to the question, Mai. Yeah, for sure, we will cover just a little bit, a touch of mental health on the topic of public policies. But yeah, definitely in the future, we are aiming to discover mental health as one of the sustainable health framework. And for now, we define 9 topics, which we are really interested as a SDG Plus Club, but it doesn't mean that will stop only here. As a member, you can add some changes and propose some interesting ideas to cover on our monthly meetings. So today we will cover first 2 topics, population health and occupational health. I will just give a brief overview, what does it mean, and some statistics and World Health Organization policies that were implemented recently and gave its results. So let's start. Sorry, just a moment. Do you see the presentation?
Yeah, we see.
Great. So let's start, and some dimensions, challenges, and innovations in the field of healthcare. We defined 4 different types of health: physical, mental, social, and financial health. I think I don't need to give some overview about this. All we understand, all are somehow covered in the Maslow hierarchy. For example, physical health is the first stage of our needs, and social health is about self-realization. Mental health is the higher hierarchy of Maslow, and financial health, when we can fulfill opportunities and enhance our well-being in the world. So let's move. And here we are having challenges in advancing medicine, in improving human health. Again, there are 5 main of them: prevention, precision, participation, personalization, and pragmatism. And I would like to stop here and give just a small overview of each of the challenges, because by understanding it, we can have a potential solution. For prevention, we have to promote a healthy lifestyle among people. And if a person will be interested in its health and understanding the basics of health, most probably the number of cardiovascular, endocrine, and oncological diseases that are the most popular ones for today will increase significantly. Next one, precision. Precision increases the accuracy of diagnostic methods. We're still on the stage of discovering new and innovative methods on how to cope with, for example, as a field of oncology, we're still trying to find out some ways on how to work on, for example, BRCA2 genes connected to oncological diseases. Next one, participation. We have to involve the client, in our case, the patient, in extended collection and transmission of data about the health. We have to create a system which will support the quality approach to managing our health. The next challenge is personalization. And it's quite important stage here because usually we have a common sense approaches to health, but every individual has its own specificities and family histories, which really influence on the way we have diseases. So we have to find the most effective treatment for every person particularly. And last challenge that I would like to discuss is pragmatism. And pragmatism is about increasing the effectiveness of healthcare by, at the same time, saving expenses, relocating budget for additional investments. So let's move further, and we have found some innovative approach to healthcare. We defined 4 of them that are starting to be used for now. The first is telemedicine, which provides remote medical care through technologies. Most of us know this method during COVID-19 pandemic. Some of you most probably consulted your healthcare provider service through internet, through some technologies without coming to a real kind of a service to hospitals. The next is artificial intelligence consultation, and it can really improve the speed and accuracy of diagnosis and treatment. And we can somehow link artificial intelligence consultation to our previous discussed personalization method. Next one, medical tourism. I think I don't need to give some background on here, we all understand. And omics services, which provide personalized and precise medical treatment today. And it's just starting to be implemented, but it gives its own results. Let's move further. For now, World Health Organization defines 7 main kind of hazards which the world still implements today. It's maternal newborn mortality, communicable diseases, which are caused by infections, bacteria, viruses, and non-communicable diseases, which are caused by genetics, environment, our lifestyle. Next one is substance abuse, tobacco control, alcohol, and the last one, environmental pollution, which is a significant factor of mortality today. Let's have a brief overlook of each of these challenges, hazards. So maternal mortality, about 84% of births were assisted by skilled health professionals, but still 16% require additional information, additional service on how to do it. And the most important thing here in maternal mortality is that it can really be preventable. And the only thing which we really need is skilled health professionals. Some of the maternal mortalities can be reduced by injecting oxytocins and good hygiene practices. If they will be implemented in the future, they will significantly reduce the number of deaths due to maternal mortality. The next one is newborn and child mortality. They're really connected to maternal mortality due to hygiene problems in low-income states countries. And again, good hygiene, injections of oxytocins can really reduce the risk. Approximately 5 million children under 5 years died in 2021, and the same number is expected this year, unfortunately. The next hazard is communicable disease. As I told, it's due to bacteria, viruses. And again, the problem of tuberculosis is still high. Approximately 11 million people fell ill with tuberculosis, and approximately 247 million cases of malaria annually reported. What about human immunodeficiency virus, which was kind of a popular one last century? It's still popular today. Unfortunately, 1.5 million people had infection in 2021. Non-communicable diseases. The topic here is much more interesting because they are due to some genetic factors, environmental factors, and our lifestyle. And approximately 80% of premature heart disease, stroke, and diabetes can be prevented. 41 million of births were assisted by skilled health professionals, which really reduced the number of non-communicable diseases in the future. And regarding the mental health, 79% of global suicides occur in low and middle income countries. And by having a kind of an overview regarding non-communicable disease, we can say that mental health issues and heart attacks are the most popular factors of diseases and in the future deaths. Substance abuse, so it's about alcohol addiction, and alcohol is a major health and socio-economic issue. And I would implement and highlight here socio-economic issue because it's mostly related to public policies which are implemented in particular country, and taxes, taxation, drink driving policies, marketing and availability of alcohol can effectively reduce the number of this problem, reduce the problem itself, sorry. So approximately 3 million deaths every year result from harmful use of alcohol, and this is about 6% of all deaths annually. It's still a huge problem for us today. The next one is tobacco control. So approximately 1.3 billion people worldwide use tobacco products. And again, it's a problem of public policies. It's a problem mostly of understanding the dangers of tobacco use. And if public policies, health professionals will find the effective method on how to increase the public awareness of dangers of tobacco use, we will combat this problem in the future. The next one is mortality from environmental pollution, and this is increasing factor of deaths. Clear a stable climate, adequate water, hygiene, the use of chemicals, protection from radiation, health and safe workplace, they are all factors which are preserved nature, which are prerequisites for a good health for us today. And as you can see, the numbers tell us that 3.8 million deaths every year happen due to the exposure to indoor smoke from cooking fuels, and 24% of all estimated global deaths are linked to their environment today. And according to the experts, this number will increase definitely in the next 10, 20, and 50 years. Monitoring health and well-being. So Anton had already given you an overlook about it. I think we can skip this part. And there are some management strategies which are the most effective today is data transformation. According to the research done in the field, only 8% of health data needed for precision medicine is published for clients, for people who have some diseases. And if we will implement this problem, we will definitely ensure a more high quality service, medical service for population in general. The next one is analytic transformation, and it's about the way we understand the target population, the way we understand geopolitical and socioeconomic factors in a specific country, which has its own specificities. If we will understand and implement in the methods of treatment, we will have a higher healthcare system. Next one is payment transformation. So it's quite interesting approach, and I would like to read everything that is written here. Organization must transform their free-for-service payment models to better understand the total cost of care and to balance the risk health systems assume under value-based contracting and population health. So what does it mean? It means that we transform our value-based system, health system, into free-for-service payment in order to monitor what kind of health issues, what kind of financial factors, what kind of socioeconomic factors we encounter every day, in order to transform the payment system into more convenient, more effective way of treatment in the future. And the last one is care transformation. It's about optimizing care management. It's about strengthening primary care infrastructure. It's about education and, in general, high proficiency of healthcare service and improving engagement of individuals and caregivers. Let's move further, and I will not stop here. We all know about COVID statistics. The presentation will be published later in our Telegram chat, and you can use it to better understand the statistics. But what I really want to talk about here on the case of COVID-19 pandemics is that we have to have a grasp on excess mortality associated with COVID-19 pandemic, because excess mortality counts kind of gives a more comprehensive picture on pandemics in general. It's not only about COVID-19, but in general, different pandemics happen in the world. And it accounts for deaths that are due to direct COVID influence and also due to indirect effects of pandemics and response to it. And definitely, it's really challenging to calculate, but it gives a more clear picture of what is really going in the world. So we have to strive to this understanding, to this marker of excess mortality in the future. Now let's have just a small brief overview of occupational health and safety and protecting employees in the workplace. So the key findings, again, only 26 out of 195 member states of World Health Organization have in place policy instruments and national programs for managing occupational health and safety for health workers. It's really low number. I don't need to kind of highlight this. We all understand globally, 63% of health workers report experience any form of violence at the workplace, and 54% of health workers in low and middle income countries have latent tuberculosis, which is in general 25 times higher than in general population. And there are 9 major hazards that World Health Organization gives us today. The first is occupational infection. So as you can see, the needle stick injuries, they still influence on the number of hepatitis C, B, and human immunodeficiency virus infections. Unsafe patient handling. Up to 72% of nurses are suffering from non-specific chronic low back pain due to low availability of specific equipment on the workplace, and they have to do it manually to transport patients from one patient room to another, and it increases economic burden, it decreases quality of life, and it increases burnout on workplaces. The next one is exposure to hazardous chemicals. Just an example, bleach and glyceraldehydes, which are widely used in post-Soviet Union countries today as a one kind of additive to hygiene cleaning agents, they can really increase the risk of new onset of asthma to be exact 67% of increased risk of asthma. Let's move further. The next one is exposure to radiation, different types of radiation, such as ionizing, ultraviolet. The probability of radiation adverse health effects in proportion to the dose received, we all know this, but no level of radiation exposure is completely safe. We have to remember about this fact also. The next hazard is occupational stress, burnout, and fatigue related to mental health. And it's a really important factor today, especially for those people who overwork and have some burnouts for some time. Intrinsic demands of the job, individual susceptibility, and poor work organization contributes to increased stress in health workers, and it's a huge topic of discussion for today, and hopefully our future sessions will be dedicated to this topic also. The next one is violence and harassment, and up to 62% of health workers have experienced workplace violence. Verbal abuse, the most common form of non-physical violence, followed by threats and sexual harassment on the workplaces. Let's move further. The hazard number 6 is risk and ambient work environment. There can be noise exposures, there can be heat stress, and poor lighting in work areas. Sounds like a very simple thing, but unfortunately, it really decreases the effectiveness of work. Next one, occupational injuries. Unfortunately, not all work providers have a specific kind of normal requirements for work. And for example, wet floors, spills, and clutter may cause slips, trips, and falls, and poor vehicle maintenance, inadequate operator training, a lack of safety restraint contribute to ambulance crashes even. And last hazard I would like to discuss is environmental health hazards. As you all noticed, every time we come to environment on the topic of health, and 1/3 of health facilities do not have what is needed to clean hands where care is provided, and about 800 million people use health facilities with no toilets for today in 21st century. There are some criteria to implement a workplace health improvement plan. Why we were talking about the hazards, in order to understand them clearly and then somehow manage the strategies, effective methods on how to combat these problems. And according to World Health Organization, there are 3 criteria that will be useful to implement workplace health improvements. First is burden, impact, and feasibility. So burden, what does it mean? It means the number of employees affected by health condition or at risk for the health condition, the magnitude of health effects for those employees, and the risk of death on the workplace, understanding current economic cost, and direct or indirect health care cost for each worker on the workplace. The next one is impact. It's potential health benefit of the program, including the proportion of employees who might be benefited. And every person, every work provider should think about the impact on health of its employee. The feasibility is a level of difficulty in implementing the invitation or strategy. We have to think about the methods which could be implemented in a specific case, and the interest of employees in the participating in the chosen intervention or activity in the future. And this is pretty much of it. I would really like to hear some comments today we have people who are related to this topic, and I'm really happy to see you're here. So please share your ideas, share your comments with us. Thank you so much.
Yeah, Yulia, I have a lot of comments. Basically one, but it's complex. So, but first, so that I don't expropriate the time from all the participants, probably let's hear out our friends, their ideas, thoughts. What would you change in the stack? What would you contribute? What does it lack? Because basically it's only the first attempt. It's a draft. It's just a bunch, the chunks of different ideas from different angles. They're not very structured, consistent, etc. But it's just to show the idea of how this white paper could look like and what could be the contents. And just to provide an impression, rather than just to present a document to criticize, it's not yet there. We are going to co-contribute and co-create it together with you. Whom do you think we should invite to this workshop, to this work group, so that we can elaborate and work out it together? Again, any comments, ideas before I make mine? Yeah, or reactions as well.
Can I say something?
Sure.
First off, thank you very much for the presentation. I really loved it. But I have a question according to the design. I am not sure. Was it like black on white on black, like white text on black background, or was it just the adjustment of my phone?
Sorry, I guess the deck was predominantly purple and white text on the black back.
Then it's the problem of my phone. Okay.
Yeah, sorry.
Then that's pretty much it. Yeah, I just had a comment on this one. Sorry.
Yeah, more kind of a technical one. So you didn't see basically half of the content, I guess.
No, I saw it. It's just that I couldn't focus because it was dark, and I had trouble like focusing on the text because I have a myopia. You know.
Okay,
But
probably we'll work on the design. Probably make it on a white back.
Yeah, thank you.
Do you have some comments on the contents, the substance of the presentation? Anyone? Did you like it or not? Does it make sense? Is it something that you didn't know, or everything is quite obvious and evident? Does it lack something that you think there should be in terms of the sustainable health topic?
I have some comments, if I may.
Sure, Stas, thank
you. I spent maybe 5 years in Mad About Me, artificial intelligence and smart medical systems, and we was created some things about healthy lifestyle and producing some scientific studying about longevity. In my opinion, that presentation is greatly unfocused. So we heard about children health, we heard about tobaccos and mental problem. I need more practical results. So maybe we need to convert this system in a small habits and task. So as I know, one most important thing over 14 years is high pressure, high blood pressure levels. So if we lowers blood pressure in most world population, approximately in 10 points, we saving more than 100 million of lives. So maybe we need to focus on these habits first. That's all my comments. Thank you.
Yes, Stas, I can but agree with you. The main question is, are you ready to do this white paper on this topic? To share your research, either from Met About Me or from your personal experience?
Yes, of course. Yes, of course. I'm in charge.
Yeah, thank you. So that would be great because actually, yeah, you're absolutely right that this presentation is kind of too wide. So basically, it doesn't cover anything in detail, and yeah, you've kind of used the term not focused. But yeah, so the expectation is that each and every participant expert would come with his or her own expertise and contribute those details. So high blood pressure definitely is one of the main biomarkers. It's there in one of the lists. And really, what this presentation lacks for now is the recommendations for the personal, for the individual level, like what exactly should you do or not do in order to be healthy, to be within those reference parameters of biomarkers, like what are the main prerequisites, recommendations, practices, probably some food or sleep or exercise, advice on how to better kind of ensure those biomarkers are within those reference parameters. But blood pressure is really a very overarching biomarker, and you're absolutely right in that. And so please, let's probably try to schedule your presentation next month on this topic. How is blood pressure, well, basically measured, and what's the situation with the blood pressure across the populations, and what's the correlation between the blood pressure and the death rate? It's evidently there. We just need to kind of put it on the paper in a scientifically based way. And then, of course, the recommendations, specifically how to lower the blood pressure. Or again, keep it within the reference parameters, because I guess for some people, the problem is not the high blood pressure, but low blood pressure, like hypotonics, right? Not hypertonics, but hypotonics. And they suffer from that as well. It's also bad. So it has to be within the interval rather than as low as possible. Okay, so Yula, you can just write Stas as our next speaker for the next month. And yeah, we definitely need to add blood pressure and focus on that, and really practical individual recommendations. And probably, Stas, even not kind of limiting only to the individual level, because as you know, there are some, again, treatments and organizational practices, technology, services that can really help individuals, because individuals are most of the time patients and they don't know what to do or what not to do. So therefore, if there would be doctors or institutions, some kind of collective institution that would really do something, help with something to those individuals, that would be really cool. So if you can, please cover that organizational level as well. And Ruslan, yes, EHS, environment, health, and safety is a very classical abbreviation used for occupational health as well. But it's not just limited to occupational health, because environment is also the kind of effect, usually harmful or impact, detrimental impact of the company to the environment, right? So it's not about employees, it's about the environment, okay? So it's a broader term than only the occupation.
Yes, I see.
Okay, yeah, thank you. By the way, do you have any comments on the deck?
I prefer not to comment because I think I will not be able to explain it well in English. But I know that you know this topic very well. So fire away your comments. I think they will cover
Yeah, so
with
as we
my
had in the
comments as well.
past, yeah, usually we think the same, right? Okay, so please feel free to jump in. I will probably start with my comments. And yeah, so I will try to spend not more than 10 minutes, so we will end probably half an hour earlier today. So, Yulia, as I've told you already, I guess just the only comment as I usually give is this compliance with the MISI principle, mutually exclusive, collectively exhaustive. So you've covered a lot of topics, and again, they probably separately, each of them are interesting. But when they're combined, really, they provide an impression that Stas has verbalized, unfocused, right? And well, yeah, we have to somehow mitigate that comment so it would produce an impression of the more focused document. It's hard to do, so I would say we can do it this way. So I've tried to write down all the angles that you have covered. Basically, imagine you were trying to depict the elephant from the from different sides, okay? And currently we need to kind of make it more holistic so that we will understand from the very first slide that we're talking about the elephant, not about the snake, not about the kind of I don't know, some other animal or whatever. So I guess the framework could look like that. And please, friends, feel free to comment on that. Either you support, agree, or not. So first of all, I guess there could be some kind of challenges or hazards or KPIs. So basically, the problematics. Like, what's the problem? What's the gap between the current state and the desirable state, right? So, like, you've mentioned all those hazards, and even at this level, we can start to distinguish or classify different subclasses of all those challenges, right? So there could be, first of all, I think they should be separated. And probably you remember from the last meeting we had on sustainable human capital management, that the problems of wealthy people or countries are different from the problems of poor countries. So probably, and I've looked in the chat GPT while you were talking briefly. So basically there could be either 2 or 3 classes of countries, either developed countries, developing countries, and also, again, if it is deserving, if the challenges for those third class of countries is different than those for the second class, then we can distinguish the third class that is called least developed countries, LDC, least developed countries. So developed countries, developing, and the least developed countries. There could be 3, but again, if the challenges for the least developed countries are the same as for developing, then we just leave it at that, like developing, because the least are still developing, but they're just even less developed than developing, okay? So it's a shade of gray. So that's the first classification. Then you can also make another dimension that would distinguish between governmental level, organizational level, and the city level, the individual level. Probably between the governmental and the organizational, they would be the city level or the community level. Again, if the challenges for those types of, for that level are unique. Okay, so again, governmental or intergovernmental, I guess those challenges are the same because like they're populational level. Probably the city level is also population health, so most of the time it's the same as intergovernmental and governmental. So basically you can leave only one governmental and presume intergovernmental and city level is already there. Then we have an organizational health, like occupational health, health and safety of employees, well-being for employees, anything regarding that level. And you've already kind of distinguished it, okay? And the third one that we've lacked, and Stas has mentioned it, is the individual level, like what an individual can do and what are the main problems and issues on an individual level. Because probably on an individual level, issues would look a little bit different, like not having an access to medicine, or lack of discipline, or lack of or not knowing what the right food is to eat, or not knowing what's the right kind of scheme of exercising is, and people either over exercise or under exercise. Again, so there could be, or not knowing about environmental factors. So I guess the lack of knowledge would be the main one, and the disability or the lack of willpower or discipline to follow those guidelines, even if you know them, would be the second main challenge. Because I guess like most of the people in the world know that you shouldn't eat that much in McDonald's or drink Coca-Cola or eat other sugar, etc. But they still do this. The same thing for tobacco and alcohol and any other substance abuse or drug abuse or addiction, right? So again, and we can try to search some scientific papers, like what are probably like psychological or intellectual related, meaning the knowledge related issues for an individual. Again, so you distinguish like 2 or 3 types of the countries, different types of countries, and distinguish 3 types of let's name actors, like government, organization, and an individual. Then you have again, you have some qualitative problems or challenges, but yeah, so I guess we should just make all of them quantitative, so that we can quantify all the challenges, like mortality rates, maternity, again, like high blood pressure, high calcification of blood vessels, high glucose. Again, so that could be distinguished on all the levels. So on each level, you have a specific set of markers that define the problematic of this area at each level. Then you were speaking about different principles that we should apply while trying to change the situation or solve the problem, like 5P, predictive, preventative, personalized, etc., or those 3 principles on the occupational health level, like burden, impact, visibility. So basically it's the focus areas, like how to approach those problems so that they would be solved. But those are qualitative, purely qualitative. It's just a kind of some sort of advice, like how you should look at those areas so that they would become more solvable and you can approach them in a systemic way, like what you should keep in mind. And don't forget about those 10 principles of the SDG Plus framework that I've mentioned, like scientificness, up-to-dateness, transhumanism, reasonableness, blah, 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 etc., empowerment, because I'm sure all those principles are like super relevant on all those 3 levels that I've mentioned. And the last thing, I guess, yeah, probably that would be the last third kind of dimension, the technology. So basically, like what can we do? What are the best practices that we could apply, keeping in mind those principles, in order to reach this or that target? Or probably 15 of them at the same time. So basically you will have the correlation 1 to 15, or you have one problem that could be solved via 15 technologies. So there could be like different sorts of intercorrelations. So basically the framework, I guess, would be super transparent and consistent and MISI compliant and practical, etc. So again, that would be challenges, hazard, that would be quantified in terms of biomarkers, echo markers, KPIs, etc. They would be separated on 3 levels, for 3 types of countries: developed, developing, and the least developed. Then it would distinguish 3 actors, like the government, the organization, and individual. And then it would consider the principles, and then it would have technology. So basically 5 factors: metrics, countries, levels, principles, technologies. So that's it. Those 5 aspects or factors or angles or dimension, I'm sure would make a 99% consistent framework that would enable us to produce an impression that this very document, white paper, first of all, is like exhaustive, like it covers everything that should be covered. Secondly, is consistent. It doesn't appear in focus. So like you just jump from one topic to another. You're consistently covering one layer, one qubit, one cell per slide. And then thirdly, it would be unique. It would be differentiated, because I haven't seen any document in the world that would be as holistic and integral and kind of exhaustive as this one that I'm already having in my mind. But yeah, we just have to make it the hardest part, just to make it. So let's just put it in our meeting report, in our follow-up, share with everybody and gather the comments. But now I would really love, and thanks Dmitry for connecting. And probably, guys, you have either recommendations to what should be done, so that our white paper at the end of the year would be the best, innovative, disruptive, mind-boggling, etc. Secondly, and all of us would be proud about this document. It would really be a game changer, and you would be proud to share it with your, employers, clients, mayors, whatever. And probably most importantly, please, each and every one of you, tell us, how can you namely contribute? How can you help? What report, what presentation, what speech can you make in a month that would cover this or that angle of the framework that I've just described? And I would ask each and every one of you right now to speak, please. Desirable with the video on. So we have Stas, who is committed to do the report on blood pressure recommendations, and probably Stas will try to keep with this framework. I hope Ruslan, together with other members.
Yes. Cancer.
Thank you, Stas. Thank you very much. Yeah, and please, others, feel free to help Stas. You can do it together. So it's not a solo game, okay? So it's a football. We are the team. So, and we're even 11 here. So kind of a full football team. Then Ruslan, I guess your startup with Dmitry Veremenko, with your other colleagues that are also part of the club, you definitely can help us to do those reference parameters. Like, what are the reference parameters for each biomarker for each age, and what are the recommendations? And I'm sure you already have it. Let's just put it on the slides. What are the recommendations that at least a person, right, on an individual level, can apply, if basically, like, so in order to keep those reference parameters of biomarkers in place, okay? Or keep biomarkers within the reference parameters. Can you hear me? Do you understand the ask? Can you do that?
Yes, I hear you. I think maybe it would be the best way to make more impact from my side is to invite Dmitry Veremenko with some kind of what will be presentation about this topic, because it's the main problem that we try to solve in our startup, to make those markers, the count of those markers as small as possible, to our service to be accessible to more people. I mean, in the cost of service to be smaller, more people to have a possibility to have these checkups and to start checking their markers. Because, for example, the classification that we discussed some minutes ago, maybe it's избыточно.
Excessive.
It's excessive because if you have, for example, cholesterol in not a normal range, maybe there will be the recommendation to check also the classification. It works somehow like this. Maybe I will take to present our startup Lithium and what it can make for the next meeting.
Sorry, Ruslan, yes, 3 comments. So first of all, I have asked Dmitry personally to join our club like 3 times, but he doesn't know English. So he can't present himself. That's why he has you and sorry, Irina, I guess, right? Or your colleague who's also Victoria, I'm sorry, Victoria, who is the member of your club, of our club. So basically you are representing him. That's the trick.
Yes.
You see, that's the problem. Secondly, about the calcification, probably you remember my comment to Amina and asked, like, is it really kind of doesn't have any intercorrelation with all the biomarkers that are already mentioned? So
Yes.
I guess you're right, and I think your approach is very good, but still, probably we can still add calcification as an optional biomarker, or like if you have money, feel free to spend that because that would provide you even more information, right? And secondly, you have said that still, if you have high cholesterol, probably inflammation or other biomarkers that are predictors to high calcification, still calcification is a good biomarker. It's just the second level biomarker. So it's not passed each month or each quarter, but it is passed if some biomarkers from the first level are not within reference parameters, okay? So it's still needed. It's still a good biomarker. And the third thing is that because you have already made the presentation of the startup, so I guess currently we want you to focus not on the startup, the service itself, but more on this methodology. So the knowledge, the content, right? So the biomarkers, first of all, like what are those biomarkers? And I'm sure basically those biomarkers are taken from Theranostica. Okay, so they haven't been developed by me or by Yulia. So they're just taken from Dmitry's research, right? Because it's been extensive, and he has spent 10 years studying tens of thousands of articles to really come to those biomarkers, and I really appreciate that. And as soon as it is already a public information, I guess there won't be any harm in making it even more kind of accessible, finally leading as well, as soon as your service becomes international, global, leading, or at least in Russia, or in Kyrgyzstan, I guess, right? So they already can pass those checkups with your biomarkers. So at least that white paper would lead to kind of your services in those 2 countries, but hopefully in other countries, probably you can also, and that could be kind of the second part of this ask to you, is to basically search for your competitors, partners, providers in other countries, like USA, Europe, Africa, China, Asia, etc. So I'm sure it is beneficial for you, like in any way, either if we don't use this information, but for you to understand what are your analogs, partners, and competitors in other countries, like who are doing similar things, not exactly the same, but similar things. Then we could enable our readers of that white paper also to pass those checkups in their countries, right? In a similar way. Because unfortunately, again, if your service would be available in 192 countries, then we won't need any other partner. But still, as it is still not yet there, probably you can name at least a couple of those probably that are kind of covering dozens of countries at the same time, right? Or probably one for the United States, one for, or well, let's say one for each continent. So that it would cover like maximum globally. So I would really appreciate it and ask you and Victoria together, and then story for me kind of passing over to setting tasks for the club members. But you see, it just doesn't work out the way. I just have to push and ping, and as you've said, and to procrastinate others. So we'll just probably like in a school ask the students to go to the board and present their homework because
and
otherwise-
evaluate them and evaluate the results. Yes.
Yes. So I would ask you to just expand and work together with Yulia to expand those slides that cover just the names of those biomarkers into the reference for intervals. Like what are the quantified measures of those biomarkers, okay? Yulia, please write down the task to respond, and to me also, because I would tell you the name of, well, at least one expert who could, oh yeah, sorry. I would just send you the document, please like ping me, where you would find the reference parameters for echo markers, okay? Like radiation, electromagnetic waves, blah, 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 things of that sort, okay? Light, illumination, so I already have those. And also I would tell you the name of the lab that is doing that kind of checkup of your apartment so that you can check that in your apartment, there is the compliance with all those echo markers, okay? That's at least in Russia, but I'm sure, and I would ask you probably, or to ask that guy that I will tell you to search for the maximum number of international companies that basically do the same, because again, this is not a unique for Moscow or for Russia service. And Ruslan, the second ask for you is also to search for those partners, analogs in other countries that can cover doing the same. The second, well, probably the third ask is to, again, because you already have that content and it's already public. So I'm not asking to do anything extra. You don't even have to do any research. Just put the content that is already there just on the slides. You can at least send Yulia something and she would help you to put it on the slide, okay? So
Okay.
Basically the recommendations, okay? So you have the reference parameters of the biomarkers, right? The intervals for each of those. And then you have recommendations for each of those, or probably for a bundle. Again, one recommendation for a bunch of biomarkers or a bunch of recommendations to one biomarker, okay? So there could be different interrelations. And please write those down. Again, and that won't be hard because basically that's the healthy lifestyle. Healthy diet, exercise, sleep, anti-stress, and things of that sort. So those recommendations, I'm sure, would cover 80% of keeping up with those reference parameters. And though those are so widespread that, again, that won't be any issue to really adduce this information.
Anton, you know,
Sure.
if you ask to do this, Dmitry Veremenko, you probably know the answer, because he would say that all these recommendations and even the reference, even the range of normal of each marker is personal. So
No, the range is not personal. I would say the range is not personal. Therefore, it's the range, because you can be at the lowest end of the range and it's okay for you. You can be at the highest range, part of the range, and this will be okay for you. But if you are higher, for instance, body mass index, right? So if it is higher than 25, it's obesity for every person in the world without any exception, right? If you have the blood pressure higher than 130 to 90, it's a bad biomarker for any person in the world. Of course, for somebody that could be lethal, and for somebody that would be just uncomfortable, but still, that would be not good for anybody in the world. That's why it's the range, okay? That's why it's the range.
For example, you have the длина талии, окружность талии, circle of the belt.
Okay, we got you.
Okay, it depends on your height.
Waist circumference, it's called waist circumference.
Yes,
Okay.
it correlated and depends with your height, с ростом.
Yeah,
Просто
sure,
зависит.
but there is no such a biomarker, right? There is no such a biomarker in the list because it's not universal.
There is. It is the most important and simple biomarker.
No,
that
but
you
there
can
is no
check by
such a
yourself.
biomarker in the okay.
Okay.
But you can
Yes, I
it's just
see.
it's just like a body mass index, right? So because body mass index is totally dependent on your height. Okay,
I will
so
try.
you can put a
The
formula
answer
there.
is, I will try.
Yeah, so Ruslan, I am 100% sure that it is feasible to put the reference ranges, parameters for each and every biomarker because there is the world standards for that. Okay, you don't be perfectionist. Okay, don't try to change the world. Just put those that are universally, globally accepted. And I'm sure they're like used either in Russian labs or in European labs or in American labs, like those are the same. And secondly, you can just pick those 80% or at least 20% of recommendations that you are sure of that are universal, okay? Because some of those probably are individual, but again, I think they could be calculated. So you can just say like, if you have this waist circumference, this height, this blood pressure, blah, 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 then for you, there is this diet, et cetera, et cetera. This is hard. We're not probably going to do that because that's what your service is about. Because it's like individual. You pass the questionnaire about 80 questions. You pass the checkup that's about 20 biomarkers. And then the algorithm analyzes 10,000 articles and induces the right recommendations individually for you. That's cool, first of all, and that's correct. But I guess 20% of those biomarkers and recommendations are so universal that you can easily do that. Okay, so we just focus on those that are feasible and disregard those that are complex for now. Okay, so let's try to do this, and let's talk with Dmitry and Victoria, and Yulia would help you, and probably Amina as well. By the way, Amina, can you please tell us a bit more about this calcification biomarker, how predictive it is, and how important it is to measure it, how often should you measure it, things of that sort, or about anything else that you feel capable of doing from within those areas that I've mentioned before. Amina, are you still with us?
I will connect with her and we will discuss.
Yeah, let's discuss with everybody who has been on this call or even hasn't been or was mentioned. For instance, Alexei Moskalyov, who has been mentioned by me or in the poll, like people who are interested or expert in this topic. So please ask everybody, probably after making this follow-up in the framework and kind of probably one slide that is depicting all those levels, dimensions, or factors that I've named so that it will be easier to understand, like, what topic can I choose? Okay, Mai, do you have any ideas? Like, can you contribute? Can you help? Can you make some presentation, research on some topic related to that?
Yes, I don't think Yulia has mentioned something about food, right?
Not sure.
They didn't talk about this, so yeah.
Yeah, I think maybe one of the problems, health problems, is wrong diet, because particularly in Tajikistan, our cuisine is really famous for its heaviness and greasiness, and most of our population suffers from what do you call that? Digestive system diseases, and even cirrhosis, and
Okay.
high blood pressure, as was mentioned before. So I don't know. I think I could cover that if.
Yeah, well, that would be great. By the way, and you've mentioned, I remember now, mental health. Probably you're interested in that topic.
I would love to talk about mental health, but I don't think I'm qualified enough. And also, I am the person who suffers from mental diseases, so I don't think I'm a best contributor here. So
You have vested interest, you see. And yeah, so you have a very good motivation, basically, right? So I was also starting my way of becoming a biohacker or a digital health expert from being in a very bad shape physically myself. It was about 7 or 8 years ago. So you're in a very good position to start your research. So don't be shy. We would be here to listen to you, to help you, to navigate you, and at least you would find this kind of group would help you, stimulate you to really search for some data and scientific kind of recommendations on how to improve your mental health or some parameters that are influenced by your cuisine, by your diet. Okay. So, Yulia, please talk with Mai after this meeting about the choice of topics. Which one is easier? What would be the depth of the first kind of iteration of that report? Again, in the correspondence with that framework that we have discussed.
I also have suggestion. We have Alona Nezinsova. She's a psychologist. She attended the previous session. I think we can ask her to give an overview of some mental health issues. I think it will be great.
Yeah, sure. And by the way, there is Ludmila Saloid. Please write this down. Ludmila Saloid. She's a psychologist. She's focusing on professional orientation, but still, as soon as she is a psychologist, probably she can help us with that. And I'm sure we have a bunch of psychologists in the chat. So just please make this kind of open call. Who wants to do is about mental health. And again, you can start from the list of those 25 or already 30 professionals that we have in regards of the healthcare topic at all. Okay, sustainable health. Okay, Maxim, are you here with us?
Yeah, for sure.
Do you think you can contribute to this document in some way?
I would say just a general comments, not the contribution, because it's not my professional area. So just like my private life, I would say that's of course about the mental health. That's very important, maybe the top priority. I would also add the sleeping regime. I would like to have enough sleep at 7-8 hours, that's like target, and have this very regularly, so not without any gaps. Of course, everyone can have a jet lags, but as soon as possible, it should be in line with your regular regime, and just become to the normal hours of sleep, and that's my point. And also I would also add activities, sport activities. Just we talked about blood pressures, and for the sport activities like walking, just walking, it's very good for the blood pressure normalization and balance that. So that's maybe all for my suggestion today.
Yeah, sure. Sure.
Thank
Yeah,
you.
so
Thank you.
we definitely would need to cover that. Yeah, please. And So I guess we would expect your contribution probably in finance area or some other on an organizational level. So let's discuss that as well. But yeah, so I guess you're already in connect with Asya Fedorchenko, who's our membership manager, and to plan your presentations on at least some topic this year.
Yeah, for sure. I got a message from Asya, so I will come back to her as soon as possible.
Thank you. Thank you. Yeah.
Thank
so
you.
we're trying to plan, schedule presentations of which. Yeah. Thank you. Thank you, Maxim. And I guess the last. I'm sorry.
I gotta go. Thank you very much for this.
Yeah, we're wrapping up. Yeah. Thank you.
Okay.
I guess the last comment should be from Dmitry. I don't know. You probably haven't been from the very beginning, or probably you've managed to understand something, and you have some comments. Dmitry Zayats, are you here with us?
Yes, guys, I'm with you. Thank you. I didn't have any startup right now, but I'm testing some ideas. And my ideas is about the preventive medicine and about the like, let's say, like a global medicine. What I mean, I think it's related to sustainable health, because here is in the United States, there is a terrible situation with the medicine. It's very expensive. There is a high cost of the medicine and high salary of the doctors. And in this time, there is a situation where in other countries, there is very low cost of the doctors with about the same quality. What I know that about 80% of medical standards is the equal across the different countries. So, and only 20% of the standards is a country specific. What I want to do, and I can make a presentation or something like this to contribute, guys, is to make to connect the doctors from like developing countries with the lower cost, with the patients who can pay the higher price for the services here in the United States.
Yeah, it would be definitely cool and really sustainable in many ways, because basically it would enable the global workforce and enable the doctors from poorer countries, from developing countries, to receive more and to develop also their skills and basically increase the accessibility and affordability, one of the principles of the SDG Plus framework, to the US patients. And probably it would even the market, and would make it equal and make it more transparent and standardized, etc. At the same time, improving the English skills of those doctors in other countries, because that's the language that's, again, universal, global, and kind of uniting people. So it would be very great, and I'm sure you has already written that down and would share in the follow-up, that we would really expect you then in a month to share some insights, data, statistics, ideas, cases, whatever, regarding this topic, and really help you to accomplish this startup, because that's a great idea.
Thank you. You know, there is already some AI tools that can help to translate. There is a lot of AI in medicine, so I think we entering the ages of AI, which is helping people, and especially in healthcare.
Yeah, sure. Dmitry, thank you very much. Okay, so dear club members, we're ending our meeting today here. So you can kind of leave the Zoom link right now, because I see our candidates, our potential new club members have already started joining the link. And for all the new kind of potential members, let's just wait probably 5 minutes So we have a technical pause here while all the participants would gather, and then we'll start in 5 minutes, basically the presentation, after which we would pass over to the Q&A session. So see you there in 5 minutes. Please don't leave the Zoom link. Thank you.
Thank you, guys.